Victor, I want to have you explain what the difference or an alternative talk to talking about young people as being at risk. Do you have a different way of framing that? And tell us what that is and why it matters.
Yeah, so for a long time in psychology, and then in criminology, and in schools and education, any population in the health, by the way, in public health, in the medical industry, um, any population that we as a society render um, having vulnerabilities. We like to use the term at risk, right? This woman is at risk of um, you know er, early onset of diabetes because she lives in a poor environment, eats poor food, or this man is at risk of dying of drug overdose because he's using at risk, at risk, at risk. And so, we can debate whether those terms work in certain arenas, but when I started to hear it in schools, particularly when I was a kid, being called at risk, and then working as a professional in schools and hearing professionals use that word so much, at risk, at risk, at risk, I started to think that um, it it'd be important for us to, if we wanted to find solutions to helping this population heal, right? This is a healing process, and this the empathizing versus the sympathizing. Is when you sympathize with someone, you're like you get to label them poor soul, you know, poor population, at risk, But when you're empathizing, you ask yourself, would I like to be called at risk? And then,
Mm-hmm. Well,
I
you're
don't.
putting on the same level. You're actually,
Yeah.
instead of looking down, you're actually looking across, looking at.
Yeah. And then I started to look at all the research on labels. There's a whole 100-year
Oh,
research on labels. And there's this theory called labeling theory. And it's not just a theory, it's studies after studies. And the self fulfilling prophecy is part of it. And there's other prophecies out there that I would love to get into in another episode. But it's
yeah.
all about when you tell someone they are of positive attributes, they somehow rise to that occasion. And there's hundreds and hundreds of studies on this, whether it's test taking, whether it's doing a task at work. So the business literature talks about this too. So, wake up every day if you're a manager and tell your employees they're going to be incredible today and they're going to do incredible things, right?
Yeah.
There's a whole industry. And then um, the negative is also true. Like if you tell someone, a human being, right, it's like enough times you're lousy, they're gonna live up to that lousiness. Same thing with risk. I'm at risk. I'm a risk. I'm at risk. It sounds the same to me. At risk. I'm a risk. I'm a risk. I'm at risk. I'm at risk. Okay, I'm a risk. I'm a risk. If you're gonna call me a risk, I'm gonna be a risk. And so when teenagers grow up hearing that before and being treated that way, they start to perform that way. That's one phenomenon. But the other one we don't talk about as much, and that is that as experts, when we start with that framework as our solution, then our solution becomes risk based. In other words, I'm trying to solve this problem. Here's my equation is a risk equation. My outcome is going to be a risk solution. And it's the same like, actually, no, no, no. It's like in math, right? I need a different equation. And the new equation is I start with promise, and then my solution is promise based. Sure, that population is still facing adverse childhood experiences. Sure, that population is still in dire poverty. Sure, that population is still misbehaving. Let's hold them accountable. But we're not going to label the person, we're going to label the behavior.